Good afternoon, everyone. I am Dr. Umme Taskia Moon from Dhaka, Bangladesh. I welcome you, all the speakers of the different countries, for this Anesthesiologists and Neurology Conference 2024. Before I jump to my presentations, I want to start my presentations with the scenario. Middle income family residing in a rural area for a couple of days. Her 7 years old boy complaining, "Mom, I am not feeling okay" during play. Her mother not noticed as not given an importance to her 7 years old boy. And suddenly, and one day in midnight, he complaining his mother, "I am feeling very pain in my chest." And when the situation is going down, the family took her baby to the nearest district hospitals. But in meantimes, the medical officer who is attend the case is not properly trained to manage the case. At first, he do the ECG and inform the patient family that I am not skilled enough to manage your case. Your baby had a bad cardiac arrest, and I think you have to move from these hospitals to the tertiary hospitals. As they are a rural family, they don't know what to do, what to not to do, and the ambulance facilities and the others are not well equipped in these emergency departments. So what do we think? What are the barriers of this case? The emergency department not ready to handle the case, first of all. The emergency doctor, the medical officer, not well skilled enough, a team not well prepared for manage the case. And the transport facilities, one of the speakers told us that the transport facility is very important, and very sadly told that the boys experts in the road. So, as a researcher, I have found the gap in our country, that the in our country is a emergency setup, emergency skilled doctors not available to handle the case. Okay, now I start my presentations with these pictures. So this is my topic. Essence of establishing fully equipped emergency medicine department for the medical professionals. This is key informant interview. I have made abstracts from the total cases papers. It is a small version of that. So I will tell from these introductions, methodology, results, discussions, conclusions, and the take-home message. Introductions. It is necessary for every physician to be updated by emergency training. Whatever your department, it is not necessary. So I am medicine, only medicine, I don't know the emergency, not like that. So Liaison Committee at the Academic Emergency Medicine 1998 mentioned that the medical education should be competency-based for the management of the acutely ill and traumatic patients. Objective of this study. I have the two types of the objectives, as general objectives and the specific objectives. General objectives to find out the views of the key informant about the essence of establishing fully equipped separate emergency medicine department in Bangladesh for the medical trainees. As these are my specific objectives, to find out the views of the key informants about the current situations of the emergency care in medical college hospital in Bangladesh. I have taken the interview of the medical colleges of the different districts. My second specific object is to find out their views about the training procedures, what is running on now for the interns on emergency care in Bangladesh. My third object is to find out their views on the level of the skill acquired by the intern during their training procedures. Fourth object is to find out their views regarding the educational policy for proper training of this intern. And my last objective is to find out the suggestions to improving the current situations of the emergency care, the lacking that may existing here. This is a qualitative portions of the study. Study period July 2022 to June 2023. Study place 8 Medical College Hospital of Bangladesh and study populations consultant of the emergency and casualty of hospitals. My sampling technique is a convenient sampling technique were adopted. Sample size was 10. Out of 12 interviews, 2 were excluded due to inadequateness of the informations. Data collection procedures. All the interviews are conducted by the researcher ahead of the interviews or to the speak schedules. The interviews are conducted face to face. And the researcher recording their interview using the paper and pencil and mobile device with the permissions of the interviewers. At the end, the contact number of the respondent were taken for the further clarifications. Data were checked and edited manually immediately after each interview, and important findings of the interviews are noted on the right margins of the instruments, that is questionnaire. Important verbatim were noticed on the left margin of the instrument. Data were presented in the narrative form according to the specific objective of the study. Now the result sections. The interviews as given in the 5 sections, their opinion is like that. Due to inadequate logistics, as we are from a very poor country, so inadequate logistics and manpower and overloaded of the patients in our government hospitals, the medical officers and the other doctors are failed to handle at a time to all the cases properly. They ship the patient to the another hospital, transfer the patients to another hospital without checking the which patient is critically ill or not, because they can't handle all the cases at a time. So they usually de-shouldering the responsibility because they are alone. So in the ratio of the patients and the ratio of the doctors in the emergency department is very poor. Opinion regarding the training of the intern. The interview said that the training should be structured and organized. Still now there is no separated emergency department in our country. For that reason, we can't handle all the cases by a structured manual, so not define the emergency department by its ownership. So the trainer of this emergency departments are not well trained, as I mentioned, that's why we are losing the lives very much. Opinion regarding the level of the skill acquired by the intern. In our countries, most of the female graduates think that emergency is the risky department. It is time consuming, night schedule is more. So they avoid the emergency issues. Rather, the trainees obtaining emergency knowledge, skills, and attitude for the emergency training, they are not capable to handle all the cases. Opinion regarding their educational policy. It is seen that the emergency consultants are not recognized as like other teaching facilities of the institute, like the medicine, surgery, and the gynae. Trainees have the poor interest due to absence of the separate academic emergency department, as I have mentioned earlier. Opinion regarding the suggestions, the interviews given me some suggestions like the availability of the logistics, manpower, and the patient should be ensured, and the regular workshop on the different emergency issues should be arranged for the teaching, learning, and motivations of the medical professional and the higher authorities. And what will be the discussion? Comparing to my study, it is seen that the recent trainees are affecting day by day due to the improper training facilities. A study by Malik Tabassum, KHL 2020 found that the trauma and orthopedics training is inadequate and poor among the undergraduate trainees. And according to the Rajaratnam University of the Sri Lanka 2016, it was seen that the trainees got 8 professional appointment in a professional unit of the emergency care, and after reviewing the different emergency care curriculum of the different countries, it is we found that they is still updating their emergency care for their trainees. But in Bangladesh, total placement of the emergency care is 5 weeks. According to the recent study, it is same that due to inadequate experience, trainees face difficulties in their day-to-day life in managing emergency situation. Besides, the study in the youngs, it is found that due to the lack of the proper skills, the emergency graduate fail to prove themselves in the job sectors. So we can tell according to the study of the India and Pakistan, that they have started the simulation-based training and the video lecturing to skill their trainees. But beside, we don't have this so much facilities to conduct the simulation-based training. I have recorded a face-to-face interview by the permissions of the interviews. Sir, this is my last question. Please give your valuable suggestion and opinion regarding the emergency care training, especially in Bangladesh.
First of all, this is not going to be happen right away. It will take time. If you want to improve the condition, the improvement from the middle of the road is not going to happen. So you need to start from the very beginning. So my preference is actually to habituate the undergraduate students at least from the third year and also, so that they can understand. So a separate entity exists as emergency medical care in the emergency department. More they will advance to the post-graduation, undergraduation, or post-graduation course, more they will start, but it should be informed to them from the very beginning. And that should be a continuous process. It's not like that in the third year, the first month they will learn about it, and again in the end of the fourth year they will have heard it again. Yes. So it's a continuous process, should be in a continuous pathway, and they need to be trained by hands-on also. Maybe they will do it only by looking at the other people first. Later on, they will understand what they are doing, when it needs to be done. But the practice, hands-on practice should be started from the beginning. And if we can start this procedure from the undergraduate level, then when they come to the post-graduation life, on the completed the internship and everything else, but then there need to be a separate department also for emergency care and a separate emergency department. Respective faculties should be trained by that time over there, and most of the logistics support has to be there, because emergency department is very much dependent upon logistics support. Yes. Without the correct equipment, even if you know a lot of things, you will not be able to applicate. So that is the main primary focus. So we should start improvement starting from the undergraduate level, then establishing a separate department with full logistic support and faculties, and regular follow-up is also very much important. Because in your emergency department, if you treat a patient, he or she may be stable right now, but after 6 hours, 8 hours, 12 hours, he may become unstable again. So emergency treatment is a continuous ongoing process. They should be managed in the emergency department or in the respective super specialty department at least for 3 to 5 days before declaring that they are out.
Okay. Thank you so much. Okay. This is the portions of my one of the part of the interviews. Sir. So in conclusions, skill hand is necessary for the making skilled professionals. Emergency department is the factory for making skilled professionals. The take-home message: emergency department is the heart of every department. To build a strong healthcare delivery system, it is necessary to establish a fully equipped emergency department for the crucial management and survival.